Aurora Breast Cancer Wellbeing is a charity that is set up for young women diagnosed with breast cancer. So those young women essentially are premenopausal. It's mostly run locally in Wiltshire, Gloucestershire, but anyone in the country, in the UK, can come and join our events. Well, gosh, back in 2015, I was in clinic and I was with my specialist breast nurse. And we were sitting there and we realised there was a huge gap in the market in what was there in terms of support for women. So across the country there are support groups and they are amazing and they provide a great service. But what we realised is there wasn't anything specific for that age demographic, or if it was mostly online or it was not accessible. I had a health scare back then, all fine, but I was thinking, gosh, if I was picked out of my life that 1 second, what would be there for me? My kids could have been very young, I was in a full-time job, and the effects of surgery, the cancer treatment, and all that follows afterwards when you're faced with a diagnosis. What is there as support when you've finished hospital treatment, or even to answer those questions when you're going through the treatment? So we wanted to set something up that encompassed all of it with the kind of tag support, nurture, and repair. Part of what we do is a networking, which forms an amazing sisterhood. So there are coffee mornings. They have a supper club for people who work during the day, because a lot of that age demographic are in full-time jobs. And then every year we do an annual wellbeing retreat. So that comprises 2 days where people can arrive the night before, they have an amazing dinner together. We make sure someone from Aurora is there to greet them. And then the next morning, bright and early, we usually start with some yoga and some breathing and smoothies. And then we go into the talks for the day. I think the thing that's really special about Aurora is that it's quite unique. My younger patients, who could be anything between the ages of 19 up to 48, people just can't help it, but they get looked at. People say, oh gosh, you're so young. So I think it just makes them feel like there is just someone there who gets it. Every year I meet people, the women who are members of Aurora, who just completely and utterly blow me away and humble me. To be able to function at the levels they do, like to be mums, to go to work, also even come on board as part of our committee and be able to contribute to other people despite them having gone through what they have, that is the biggest highlight. And to be around that, I think, is a real privilege. When somebody receives a diagnosis of the right age demographic at the NHS or the private hospitals, they will be guided to go online and complete a little form by the breast nurses that are there. If they're not in a hospital where Aurora is local to them, they can just email our email address, or we have a Facebook group. And it's important that you do fit the age demographic. So when it comes to Aurora's goals, right now the main things that we do are creating a network and sisterhood, providing holistic care outside the NHS or hospital care, and psychological counselling, which we provide because NHS waiting times can be such that we can't get that care to people, so we provide counselling sessions for them. Moving forward though, we want to be able to expand that so it's more accessible. There are more events to do with what people really want to know about. I think after a diagnosis, people would want to know exactly what they should eat and why they shouldn't. They want to do everything possible to reduce risk, but also to spread that awareness. And I think the next biggest step, which is a huge one that we're hoping to take next year, is to set up a secondary support group for people so that it's not just women with primary breast cancer, which is what we're focusing on at the moment. Some of those women with primary cancer may go on to develop secondary cancer later on. We want them to know that there is something there when they get there.